Hey everyone, in this video I am doing pretty much a little bit of filler everywhere across this patient's face today. So I started off, did a little bit in her lip. She's had her lips done before, but it's been a while, so we kind of just did a little plump in the lip. Next, I am going and doing a little bit in the chin. So this patient has always had a deficient chin. We pretty much work on it every time she comes into the office because I usually don't like to do all that much in the chin in one sitting because it can be very painful for the patient. This area, the skin, is very tight. So the more volume you add, especially a high G prime filler, it's going to create more swelling. And it's just very tight and uncomfortable, lots of pressure for the patient. So usually I do about a half a cc or half a syringe in one sitting, and then see the patient back and do a touch-up if I need to. This patient has had her chin done in the last 6 months, I think it was, so we did not have to do much at all. So I basically just did a little bit. Now I'm using the rest of what I didn't use in her chin, just lightly in both of her cheeks. So she didn't have much of the syringe left, but I wanted to use it up because I don't really like to save filler. So we are using it in her cheeks, just doing a little bit of an enhancement. So just doing a little in the lateral aspect there, and then you can see I'm focusing the majority of it right into the apple or apex of the cheek. Right before I went in there, you can see I just kind of palpated for her infraorbital foramen just to make sure that I feel it, know where it is, and that I'm staying away from it. That's going to be the biggest no-go zone for cheeks. These injections are always deep down on bone. That's what we're trying to mimic with filler in this area, is that bone structure. Giving really nice contour to the cheek, highlight. That's usually where natural light will hit the face to really bring out the highlight of the face. So the apple or apex should be the most full area, and that's kind of where I'm focusing it, as you can see. Always using a high G prime filler, and then always aspirating and low and slow pressure when I'm administering the product, typically never more than 0.1 in any injection, just to kind of ensure safety. All right, now that we've done that, what I'm going to do is do a little bit of mental shadowing. So we used a different filler in her lips, and again, this was just a little bit of an enhancement. She didn't want much in the lip at all. So she said, where else can we use it? And I told her she can use a little in the mental shadowing of the chin, or like that pre-jowl sulcus area, because she has such a really strong chin. And I wanted it to kind of just be more like seamless all the way back and just look really natural. So I'm adding just a little bit of a lighter filler in this area, just fanning it through with a cannula. Typically, I like to keep these injections like a little bit more superficial than I would the ones I was just doing deep down to bone. So you can see I'm using a cannula. It's just a way to get through the tissue a little more easily and safely, and just give product in a larger surface area, rather than with the needle, you're very precise in staying in one area. So that's what I'm doing. I first gave her just a little bit of lidocaine to numb the pilot hole of where I went in with my needle. And this is a Comfortox cannula, and it's a 25 gauge by 50 millimeter length, and it's probably my favorite cannula that I use for filler. Typically, if I'm doing lifting threads or something like that, I use a little bit of a bigger gauge, but for filler, I like to use a 25 gauge. So you can see I'm just kind of going in and lightly giving her a little bit, and I'm going to do that on both sides just to kind of use up the syringe so that she gets what she paid for, and we aren't saving anything for her. This patient is awesome. She's been coming to me for a few years now, and she's always a great patient, and she understands facial balancing, and that, you know, if I gave her a little lip, she's going to need a little chin to balance that out, and the mental shadowing and the cheeks and full face treatment to really give her the best results. So we love patients like this. As you can see, this area can be a little bit more difficult to get in with your cannula because of the modiolus of the mouth. So like the corner of the mouth where everything kind of comes together, it's a little bit of a thicker tissue. So it can be more difficult to navigate with the cannula. So you can see I'm really kind of twisting and advancing it as much as I can, obviously without, you know, trying to hurt the patient. But most patients do really well with cannula because it's not sharp and it just kind of glides through the tissue really nicely. So that is about it on that side. And then I will just go in and massage and make sure everything feels really good. So I always massage over the areas that I did filler to ensure it's incorporated in the tissue. I don't feel any major lumps or bumps. And it also just helps just in case there's like a blob or glob of filler in any one area. I'm just kind of softening it so it's not compressing or causing any kind of crazy swelling or anything like that in the patient's face. So always make sure everything feels nice and smooth. This patient is very sensitive, so she always gets super red, but that is it. And then once we are done, she is good to go, and I will see her back in 2 weeks just to see how everything is looking. Thank you so much for watching, everyone, and we'll catch you in the next one.